This is the DocNation podcast. We are a movement founded by doctors, for doctors, dedicated to empowering medical professionals to reclaim control over healthcare decisions and advocating for their fair share of the industry's resources. Please note, the views expressed are those of DocNation and not necessarily those of our guests or referenced health centers.
Let's start with that, Dr. Patel. What are your thoughts on that? If you don't mind, I'd like to just start with that question. Why do you think
About which part?
What?
About which part?
Why do you think the IPA has gone from 300,000 to 150,000? So if there's 1 million physicians in the United States, and 300,000 were a part of the IPA, and I don't know what year it went from 300,000 to 150,000 over the last, go ahead, Justin.
10 years.
Over the last 10 years, it's gone down to what, call it, 15%. Why do you think that is?
Well, the biggest thing has been the Affordable Care Act. And really, my dad was in private practice for a number of years. I used to go with him to buy some of the chemo. My mom did his billing growing up. And really, with the Affordable Care Act and the introduction of electronic medical records, it really added so much compliance and a lot of different rules and regulations that made it so difficult for private practice folks to really stay in business. And then on top of that, with the advent of, and I'm not saying that, obviously the Affordable Care Act had good things that came out of it with, requiring insurance and so forth, but you had a lot of different types of insurance plans that came out that really cut reimbursement or really added different stipulations to reimbursement. And so it became very difficult. And so, if you look at the practice I'm part of, we have over 20 oncologists, and we're considered a moderately sized private practice. But if you're a solo practitioner or private practice, those days are unfortunately gone. It's so difficult to maintain the overhead costs, to have an EMR, to, keep up with this and that most, people have no other option but to be employed. It's really sad seeing that.
So you said the ACA and the invention of the electronic medical records, based on just purely because of cost. The overhead to be a solo practitioner is becoming impossible to be able to keep your doors open.
Are you saying that if it was cut in half, the cost, that would make a difference, or a lot lower? Is this just the technology itself is the issue? Because I think a patient would be like, well, everything's digital. Why wouldn't I want to have my doctor in the 21st century doing digital things and running their business? If they're not in the 21st century doing current tech stuff, then they're probably not a good doctor because they're old fashioned, they're out of touch, stuff like that. So I would want the EMR to be up to date. So why is this EMR and the regulation requirement, why is that a problem? Why is that not good for patients in this regard? Like what's the indirect effect of what this is doing for them?
So I would say this: electronic medical records are not made for doctors. They're made for insurance and billing. Really. It was never created with the intention of providing better care. Maybe you could argue Epic, right? But, in many ways, Epic is completely unaffordable. Most people in, small private practices and so forth just use whatever generic, EMR system. All you're doing is putting on documents in one single area. But when it comes to actually providing care, I don't just go based on the EMR. I have a system where I look back at labs, I look back at all the documents that I got, and I make a decision. I think aside from maybe having some radiology on the computer and maybe having some labs on there, I don't think having, so-and-so like paper on an EMR makes a difference for me. I always go through everything in detail. But the problem is fatigue, So really, I was talking to my wife about topics I wanted to talk about because this can be so broad. But, one of the things is, man, EMR and being forced and a slave on the computer has led to physicians being so unhappy. Because I think of my dad and back in the day when he could see patients and really provide care and not have to worry about that. On a given day, I'll see my patients, I'll write my notes, I'll go through 200 labs on a computer screen. I put in orders on a computer. The thing I hate the most about my day is that I'm forced to spend 80% or 90% of my day in front of a computer with the least amount of physician interaction. And it makes me sad inside thinking that every time I go see a patient, the first thing I'm thinking is, wow, I have to run a computer and take care of this and then move on. That's the worst thing.
That's insane. So you're saying 80 or 90% of your time as a physician is spent uploading information for the patient?
Yep.
So are you doing a lot of this when so the patient's right here and you're doing a lot of this? Or do you spend 2 or 3 or 4, 8 minutes with the patient and then the rest of the time you're doing this?
Yep.
Is it both?
I would say I try to spend, like, whenever I talk to a patient, I just look them face to face for, however much time I have. And then I actually, we have like a dictaphone. We're lucky. So I have a dictaphone where I'll dictate it and then I'll have someone type my note for me. But, everything else, when I'm talking to them, I'm putting in labs and orders and stuff. Everything's just like that. It's horrible.
Yeah. Justin, you were talking about, well, if my physician doesn't have the technology, then they're probably living back in the Stone Age. And I'm not attracted to that. And I got to say this from my perspective. Let this be from me. I'm 36 years old, but I feel like I'm old enough to remember when I got to sit down with my doctor and he looked me face to face. And I didn't go to the doctor very often. I went once a year for my annual checkup. But man, he was like talking to me about high school. I was an athlete in high school. He's talking to me about sports and how he saw me in the newspaper. And I'm like, I would always go home and tell my dad, man, our doctor is awesome. Like, I really felt connected. And he probably looked at me and did some checks and said, this guy's totally fine, but still spent time with me, right? The trust was there. So when something weird would pop up, I would feel totally comfortable to reach out. That relationship there's no time for that. You can't do that anymore. To think about the fact that this guy's talking to me about me being in the newspaper for sports, you guys could barely talk about something that is detriment to their health. It's more, okay, I am owned by the computer screen. I'm owned by the computer screen, and I can't even really have the time to communicate. And if I do, I probably won't be very financially successful at all.
Yep. I mean, I think electronic medical records started off with the right intention of really just finding a way to get everyone together. The problem is there's so many electronic medical record systems. None of them talk to each other, and none of them are physician-centered. They're all billing-centered. And so at the end of the day, what do? You just get a bunch of clutter. You get repetition of movements. Everything is just so discombobulated that it doesn't necessarily help with care, I feel like.
I'm glad you're bringing this up. We help doctors start practices. We help doctors manage their current practices that are potentially struggling. And when we talk about EMR systems, the first thing that we say is, what is affordable? What do you know about? What do you feel comfortable about? But it's price is number one because of what you said. We don't need to have the EMR system be the physician. We need to put data in this, and we need to be able to run this EMR system efficiently so that it doesn't take away from our time. So when price is the number one issue for a solo practitioner, you can see why the big hospitals are winning. They're thinking, okay, give me everything because we can afford it, which is really a competitive disadvantage to the solo practitioner.
I agree. And honestly, at the end of the day, I was I rounded a hospital that we're affiliated with. I was talking to them about, upgrading one of our EMRs to another one. Epic was asking for $1 million up front for an upgrade. And we're like, we don't have that type of money. We're a small community hospital. So to even think about that type of amount of money required to just keep an electronic medical record system going, that's ridiculous.
Yeah.
What were some of the topics you and your wife were talking about that you were thinking about bringing up? Because I'm most interested in that, actually.
Oh, gosh. I didn't want to dive too much into the business side of things, but, how to keep a clinic afloat and some of the unnecessary business things you have to learn about, thinking about reimbursement, drug reimbursement, services. The other thing we talked about was burnout in general. And then what else did I write down?
Well, let's do this too, though. Reed, I haven't told you about his background with organizing doctors. He has a prior life experience that got him immersed in the thick of organizing. And tell us, Dr. Patel, what you did and what that was like and what you see as far as being able to organize now, even when you have private practices and you have employed doctors.
Well,
I haven't had a chance.
I mean, you're the son of a doctor, so I'm wondering, you got to watch it growing up. You got to see what it was like. Tell me why you started this and what is it? Because you're right, Justin, I don't know about this yet.
Yeah. So, honestly, for me, when I was a resident in Chicago at UIC, I'd heard about, unions, and my dad, when he was a resident in New York City and Brooklyn, he had been part of a resident union. And so, they came up to me and they kind of brought up that idea of a union. And I realized when I was in Chicago, everyone else had their own union. The nurses had their union. Hell, the transporters had their own union. And I remember my first weekend on, there was a big strike and we're having to divert patients over. I remember having to wheel my own patients down. And I started thinking, and I was like, why is it that in the name of morals and so forth, that physicians are asked, hey, don't do this, don't do that, but everyone else can? How are they not part of the system as well? And so I started realizing, I was like, that's not right. I don't think people will listen until you have some type of formalized bargaining power. And I think doctors are so disjointed in general, and there's private practice, there's hospital based, that there's been no group. And, you know, the AMA, I remember hearing your all's podcast with that gentleman that's part of the AMA. I disagree with the AMA because I think for the longest time, they've not done a good job of really bringing people together. I remember back in the day during President Obama's presidency, and I'm not trying to be political, but you know, the president of the AMA and President Obama were grabbing lunch and dinner together, and they were both based out of Chicago. What type of, you know, signal does that tell us when something like that is being made without actually getting the opinion of physicians on how they feel about certain things?
So then what happened? What'd you do?
So we started the process. You know, we got about 50 or 100 residents at UIC to basically sign a paper, and then we went to our hospital board and we said we want to start a union. And they initially were trying to find ways to get us not to be interested in it. And ultimately, once I graduated, I went to fellowship. I heard that it got passed, and now their salaries went up a lot. They have more benefits, but more importantly, they have more bargaining power in determining what's safe practice of medicine out there. And I think that's important.
When you say we started it, you mean you, or was there a couple other people who were like
So it was me and like 4 other people, and then we all graduated and we kind of kept the momentum going as well. And then finally we got enough ballots signed where more residents, actually, I think it was greater than 50%, said they wanted a union, and then it got passed.
I asked that question because I want everybody else out there to hear that. Like, I'm not saying it's easy. I'm not saying you guys have a bunch of time on your hands at that time, but I am saying that it's doable, and that you actually do have the power.
And there are pockets around the country that have these. And why isn't it that every single location has these as the beginnings, the foundation of what would come after you leave? It's like, what you leave an ecosystem that actually is becoming more favorable to you. It's respecting you more. It's giving you more say in your decisions around how you should do things. Why does that not carry forward? Why does it not? Because you moved on. And I know that the way that the rules are, you can't have a union based on your occupation class. It's based on employer by employer. It isn't that way necessarily overseas and other places. But why do you think it's not being carried forward beyond the residency fellowship stage?
There's this old school idea that, you know, if you're a doctor, you do whatever you need to take care of this. And I think a lot of the older folks would say, hey, no, what do you want a union for? You know, your goal as a trainee should be to do as much as you can, take in as much as you can to become the best doctor you can be, and then move forward. And I think that's the type of culture that's always been perpetuated, you know, onwards. And so I think that needs a change, because the reality is I was talking to my dad, and you know, when he was a trainee, he could go out and provide good care to people without having to deal with putting in an order or dealing with this or that and that. Now there's just so much fatigue and burnout because of being in front of a computer, because of electronic medical records, because of coordinating care and all these bureaucratic tasks that lead to all these things, that there's no way one person can do it all in one day.
Yeah, your dad's coming from the heyday of medicine.
I mean, those were the golden. Those were
right when there was autonomy. I mean, that's really the number one word. I think that people look at this and it's easy to say, okay, this is a money grab by physicians. It's not that. It's not. I mean, look at the CMS cuts over the last 10 years is ridiculous. So not only are you getting paid a lot less, but you enjoy your job a lot less. Physician suicide is twice that of non-physicians in the United States.
Why is the average population? It's double the average population.
Yep.
I just looked it up to double check the numbers.
What that?
No, not that. Something related to it. What percentage of medical students would you say, Dr. Patel, do you think are on antidepressants?
Is it 50%? 75, like 3/4?
75.
That's ridiculous.
Holy snap. That's crazy.
So this is this is where the sausage is getting made. This conversation, this is big time. I want to take this offline with you and
Mhm.
look at what you did at UIC
Yep.
and get a process going. Why don't we have this at every single location? If we had it at every single location, people would start to maybe realize that there is a serious problem that exists. That once you leave, we need to start taking with us some of what we've done in the past, which is in those training years. 75% of medical students, that's a problem. Like,
It's a huge problem.
I mean, I just looked it up right now. That's how bad it is.
I think what I'm about to say, I think it's okay for people to hear, but when you have the tip of the spear of
Mhm.
Americans, right? Like it takes a certain level of person to pursue medicine, to become a doctor, okay? It's not average. It's not
Well,
an average
you're
thing.
given 8+ years of life to take care of
It's not an average thing. Not everybody can do it mentally. Not everybody's even smart enough. I mean, that's just the truth. When
Yeah.
you're a struggling patient and you potentially on your deathbed, you want to look up and think, I'm hoping this guy or this lady is really, really, really smart and really, really good, maybe beyond what I ever could have achieved, because I'm looking for life-saving results here.
Mhm.
And when you have those people going through so much that 75% of them need medicine just to be cognitively okay, that's horrible. That's
Yeah.
disgusting. And why is
Yeah.
that? And
And
why
it
is
says
that? Because you have no
anti-
autonomy. You do not have the autonomy to practice care the way you want to. You have to become a whole bunch of different things just to be a doctor. I mean, I think the biggest thing here for me in this podcast is that you spend 80 to 90% of your time on a computer screen. I don't
Yep.
want to be your patient. I'm sorry. Like, I
Yep.
don't want to be your patient.
Yep.
Well,
That's
no patient wants to be a patient to anybody, and that's the way it is inherently across the board.
Yep. That's the worst thing about it. And
I was
honestly, I think that's what's driving depression rates, right? I think, like when I say it this way, and it's not really that politically correct, but when you look at how medical school and how training process has changed, you know, back in the day, people that went into medicine were people that really just had some type of connection with society. They liked science. They wanted to provide greater good. I think medical school has changed their admissions to where they're selectively choosing people that are more research or statistically oriented and less service oriented, despite grades. And I think on top of that, they add a whole slew of requirements like, oh, you need to have this research paper, you need to have this done, this done, this done. That does not, I guess, reflect or add inherent value to becoming a better doctor. And in doing so, I think a lot of the folks that are there are just, they're constantly doing this, and that they're so disjointed from society. I honestly don't feel like I felt like my calling come back again until I started back in my private practice, and I feel like I'm part of the community I'm serving.
Wow.
It brings me so much joy. But I feel like if you're in a large inner city, or you're at a hospital-based practice, or you're kind of moving around, you don't feel like the people that you're treating are actually benefiting from the care you provide. It doesn't feel like you're part of that.
So to go through all of that, 8-10 years of school,
Or more, yeah.
to get to, or more, to get to a place where you're like, wow, this is not what I thought it was. And I think most people sit in that. They're like, okay, I just spent a decade of my life doing this. Not a lot of people are reaching out to do private practice. So they're in a position where they hate their lives. They're working 70, 80 hours a week. They're not making the money they thought they were going to make. But what else? What are they going to do? Where are they going to go from being a physician? I mean, that's the truth. What is there a level that you can step up? Like maybe like an astronaut? And I'm not trying to make anybody feel less, but when you become a physician in the United States, that is like top tier. Where do you go from there? So you're just going to be miserable for the next 30 years, 40 years of your life. And I truly believe that's where most physicians are today.
Yep. I agree 100%. I think really where we go is we start by creating a unifying process that brings physicians together and is a voice for them. And I think the AMA really needs to be reset. And I think something like what you guys are talking about with getting a union in its simplest form that brings people together is the next step.
And I also would like people to know that, there's a lot of things that need to change for healthcare as a whole to change. But if you want to make a change and you want to make a change immediately, understand this. Our company exists to negotiate contracts so you have a fair chance. We've gone through all the EMR and EHR systems, so we know which one to get you. We know how to do the business side of things to get you to a place where you can actually provide a living for your family and be an independent physician. And so we exist to do many things, but that is one thing we exist to do, and we're here to do that. Dr. Patel, you've been wonderful. Thank you for your service, and thank you for doing all the things that never made you money, that was outside of medicine for the betterment of your colleagues. And we were on a podcast right before this one, and this gentleman is a seasoned physician, and he said we have 10 years left. We have 10 years left to turn the tide before this becomes purely corporate medicine. And if we don't do it in 10 years, we never will. And DocNation, I will say this, we have hope and we're fighters, but there's roadblocks left and right. And I will say one of the biggest roadblocks is physicians themselves not being willing to speak up. And so very grateful for you and for your time and for your history.
Yeah, Dr. Patel, maybe for your last word, share with the DocNation what you would say to them about joining this cause that we're talking about.
Yeah, I mean, I would say about joining this cause, I feel like whatever you do, you always have to fight for, no matter what. Every group, I mean, whether it be nurses, pharmacists, lawyers, any type of group always has to go to the bargaining table, and physicians are no different, unfortunately. And so, bargaining in general does not mean bad care. That does not mean that you are not providing the best care for them. This is you sitting down and trying to find ways to provide better care while being able to take care of yourself.
Excellent. Thanks so much, Dr. Patel.
Yeah, thank you so much for your time.
Thank you, guys.
Have a great day, Dr. Patel. Thank you.
Yes.
Bye.
Bye. This has been the DocNation podcast. If you like what you heard, be sure to subscribe, rate, and leave us a review on Apple Podcasts, Spotify, or wherever you are listening to us. Your feedback really helps us reach more listeners like you. We'd also love to hear your thoughts and any topics you'd like us to cover in future episodes. Don't forget to follow us on Facebook, Instagram, and LinkedIn for updates, behind-the-scenes content, and to join the conversation. Thanks for listening.